Hey guys, I did a live this morning on one of my books, and it's it's author Asira, and I said that I would come back and do a video on the lady Kendra, who is who says that she was in love with her psychiatrist. Now anybody can speak on it, right? But I'm going to look at this from a couple of different directions. So just a little history on me and what I do outside of writing books, and why when you read some of my books, some of my um, characters, are having like issues with depression or anxiety or PTSD. A, because I do. B, because I do have 2 degrees in psychology, a bachelor's and a master's, and I'm also a nurse. So I have worked in the mental health field as a counselor and as a mental health clinician, and that has included me doing assessments, working closely with psychiatrists on programs that and treatments, that would benefit patients. So I do have like that insight, and then the insight of having mental health things going on with myself, and I am going to do ketamine treatment videos as well. I'm having them edited for you guys, and also just being a watcher of people, right? So here's the thing with Kendra, on the medical side. If you don't have her history, like you don't have her medical history, you don't have her social history, um, it's not for me to come on here and say, oh, this woman obviously has this going on or that going on, and give her a diagnosis. That would be, that's not how it works. You would have to speak with the person, have their history in front of you. It's a lot of different things that go into it. I will say that it seems as though she is having some kind of episode. She, maybe some psychosis, some type of mania going on, um, and she is doing it in the public eye. I don't think it's funny. I think it's sad, but I think it's dangerous as well. And who it's dangerous for is this psychiatrist, and it's dangerous for people who don't have the insight, because a lot of people, whoever was going over to that psychiatrist and doing whatever on his page, or seeking him out, with some kind of retribution in mind, because she did dox him, and I do believe that she did it purposely. That's dangerous for him. And I believe that just her being a YT woman, anyway, is dangerous, because she can obviously come on and she can operate from a place of privilege, while she's having this episode, and it can cause harm, to this man, especially because he is a person of color. So it's just, it's really crazy. So I do think that there was some privilege involved, and that was the other part that I said that I would bring up. So the first thing is, it seems to me, without having her history in front of me, that she is going through some kind of mental health episode. But she doesn't fit how, what people think when they think that someone has mental health issues, right? She's there, she looks presentable, she speaks clearly and with authority, and she speaks, as if she just knows what's going on. And so there are people who will lean into that. But I want to say that mental illness does not have a face. It does not have a face. So her being able to speak coherently, and she's throwing out all of these diagnoses and these terms that I'm pretty sure she researched, um and she is actually projecting onto the therapist, the feelings and all that she has. It's almost a break in reality when you look at, things that she herself says, that she conveyed to the psychiatrist, and his response back, and her taking that response and twisting it, to further feed, her delusion. So it's just it's complicated. It's really complicated. I'm sure that she has a laundry list of diagnoses, and I'm sure that she has a laundry list of medications that she is on or has been on in the past. And it's crazy, because we're never going to hear from the psychiatrist, because due to HIPAA, he can never come on and say, okay, listen, this is what really happened. But he did not handle it inappropriately, that I can tell. Of course, we were not in the room. If she did convey feelings to him, it a therapist, a psychologist, a psychiatrist is not going to automatically just toss you off. There's a process in it, and sometimes you may just want to dig deeper into it to kind of help that patient, in their recovery. And sometimes, just tossing them off to somebody else, that would impede, them getting help and in their recovery. So sometimes it's good you would explore those feelings with them or talk to them about it, you know what I'm saying, and try and see, okay, get them to kind of see where they're going off track a little bit. So that is how that works. Also, psychiatrists usually just deal with the medication. So, not saying that they don't do therapy, but they will talk to you a little bit so they can kind of get a handle on what's going on with you. So that's why you talk to them generally every few months. You don't really usually have your talk therapy sessions with the psychiatrist unless it's really something that they need to deal with. But they do prescribe the medications. Any medication changes. So they will ask you what's going on with your body. Are you using the bathroom? Are you sleeping? You know what I'm saying? What's going on? And when she told her therapist about, what was going on with her sexually, the therapist may have said, hey, talk to Dr. So-and-so about that, because some medications can affect your sex drive. So can weight gain and weight loss, just different things that people don't think about. So that was not her therapist feeding her to her psychiatrist. That was a therapist saying, it seems like to me, because I would have said, hey, okay, so let's talk a little bit more about that. And you may want to bring that up with Dr. So-and-so, when you talk to him, when's the next time you talk to him? Okay, you talk to him Thursday. Okay, yeah, bring that up with him. I'm going to make a note of it anyway. But, bring that up with him, because that may be a medication that needs to be tweaked. Maybe it needs to go up. Maybe it needs to go down. Maybe she needs to come off of it. You know what I'm saying? But he needs to talk to her and determine how much it is affecting those areas. You know what I'm saying? And if, continuing on that medication is worth it. So those are just some things that some people don't understand if you're not inside the mental health community. So let's go on to what I want to say about how dangerous what she's doing is. And it's because, she is palm colored and he is a person of color, and she gets to platform, basically trying to discredit this man, and anyone else that she's trying to, discredit, or, is in any kind of relation to her. And in some cases, with people who don't understand, what is kind of able to do it. I mean, enough people are standing up and saying, girl, which I appreciate. But this can cause somebody, who is and I know there's a difference between Black people or, indigenous people and people of color, but this can really affect the livelihood of, a person of color. Let's say I was her therapist, and she comes on and says, oh, Asira, she was feeding me to the psychiatrist and they were in cahoots, and he was getting his, I'm saying, his rocks off. And she would just tell me, oh, go talk to him about your sex life. And, oh, talk to me more about this. And, oh, go talk to him about that. And do you know how many people, I'm saying, on TikTok would be after me, I'm saying, especially if she accidentally doxed me, and they would really be after me because I don't look like her, and she is operating from a place of privilege, whether she wants to acknowledge it or not, because when palm color women start to crying, we know what happens to people who are not palm color. Okay. We can go all the way back, back in the day, to Emmett Till. A palm color woman started crying, and we see what happened to that little Black boy. So it still happens in 2025. So I just want to get on here, address her, address mental health in a way, but then also privilege. I'm saying, even within, her health crisis, she has privilege that is affecting this psychiatrist and others within the mental health field. So I just want us to realize that mental health does not have a color, it does not have a certain aesthetic, and be very wary. I mean, it's almost scary, you know what I'm saying, to someone, because if I was someone of color, I'd be like, man, I don't know if I want to really treat people who look like this, you know what I'm saying, in this situation. Like, I'm pretty sure this doctor is about to be treated for PTSD as well, even though he hasn't, from what I can tell, done anything wrong. Now, has he been perfect? Probably not. Nobody's perfect, inside of practice or outside. But in this case, he has not, that she has relayed, done anything wrong. And I just want us to be aware of the privilege that people have, even within their mental health crises. So I did just want to put that out there for you guys. All right. Y'all have a good day. and pick up a book by Sarah.